what's going to happen when I can't remember anything anymore? What will you do?
I'll be here. I'll never leave you.
The movie The Notebook not only depicted the debilitating effects of dementia, but the impact it has on loved ones. The numbers are startling. It's estimated that Alzheimer's cases will triple by the year 2050. Healthcare costs related to the incurable disease will skyrocket 500% to $1.1 trillion. Alzheimer's patients spend 3 times more on healthcare costs than other patients. Several trials are underway to try and help to, of course, prevent the disease. Terry Suresh, nurse practitioner and founder of Hormonal Health and Wellness Centers, is here to explain how hormone imbalances may increase the risk of Alzheimer's disease and early dementia. Such a serious subject we're talking about.
Right.
And can you please explain the correlation between hormones and this startling increase? I mean, first of all, why is there such an increase in Alzheimer's?
Well, it is startling statistics, and one of the key reasons is because we're simply living longer now than we had. I mean, the average life expectancy now is into our 80s, 86, I believe, and so we really haven't paid a whole lot of attention in the past to prevention. So we really think that's it. And of course, there's environmental factors and all kinds of other things in our environment that are exposing us to things that are increasing this issue. But age is part of it, for sure.
Testosterone and estrogen and the role that they play in brain health, really, is what we're talking about, essentially. Am I right on that?
Right. Yeah, it's really fascinating because studies are showing more and more that hormones are playing a key role in brain health. Testosterone specifically, but what we see with both hormones, and testosterone and estrogen, is it actually decreases brain cell death and decreases beta amyloid deposition, which is the hallmark of Alzheimer's disease. When patients get scanned and get diagnosed with MRIs and they see this deposition.
Right, those are things we've seen on the news.
That we've seen, so we see that these hormones play a key role in preventing that.
Okay, so testosterone specifically, low levels of testosterone. What is the risk factor in that, and how low do they have to be?
Great question. So what we've seen in studies is men with a testosterone level above 800 have a 70% reduction in Alzheimer's disease risk. Men with a low testosterone below 800, and that's not considered low in a lot of circles.
That's what I was going to ask.
Right, are 3 times more likely to develop Alzheimer's dementia. And we see a huge role in women because estrogen also plays a role in the brain, so they have a big risk of Alzheimer's dementia when their hormones begin to decline.
Okay. A lot of us know that most doctors, or a lot of doctors, not most, I don't want to say that, but this is a real hot button issue. HRT, hormone replacement therapy.
Right.
A lot of doctors recommend that you discontinue that after the age of 64. So what are your feelings about that with regard to all of this?
Right. Well, there's a great study that actually addressed it. It's the Cache County, Utah study. And in that study, 1,800 women were looked at on HRT, hormone replacement therapy. And what they saw was a 30% reduction if HRT was used for 5 years, and if they used it for 10 years, the reduction in Alzheimer's disease risk was that much greater. So we see a huge reduction in Alzheimer's disease risk in men that keep their testosterone levels in the optimal ranges, and for women who keep their testosterone and estrogen levels optimal. And that's a key thing because lab tests often have a large range of what's expected, and many practitioners interpret that as normal, but that is not optimal. So there's a lot of disease risk that happens as testosterone levels in men specifically fall below 800. So an optimal level for a male is about 800 to 1100. An optimal level for a female is anywhere between 70 and 100.
Okay, you and I were talking before we came on. This is a hot button issue for a number of reasons. It's a very complicated issue.
Right.
It's a very individual issue.
Correct.
People need to get good information. So you have some webinars. We want to hit a couple things. Webinars, and also you have a special.
Also, I'm so passionate, as you know, about educating, and we have a full webinar on our website all about hormones, hormone imbalance, the disease prevention that happens, all of the studies, not all of the studies, but some key studies that go along with it, because what we want people to understand is this is evidence-based stuff. It's not just someone's opinion. And of course, we always offer our GMT viewers a 50% off their consult fee to come in and let us check your hormones, let us see where you're at, and get you under the way for prevention, because all of the medications to treat Alzheimer's right now are really symptom-based. There's not a lot. You can't reverse the disease once it's there.
No.
So we're really paying attention to prevention.
Okay. Terry, thank you very much.
Thank you.
Glad to have you back. You were gone last week, so we're glad to have you back this week.
Thank you.
You can find out more by calling Hormonal Health and Wellness Centers in Southlake. The number to call is 817-328-8376. And in Rockwall, 469-402-1877. You can also find out more online at hormonalhealthandwellness.com. And we'll be right back.